All right, welcome back, anatomy students. We are in Unit 13, which is on digestion. You guys are responsible for the terms on pages 194. And I'm just looking through your lab book now. It's a little bit lengthy chapter. The digestive system has a lot to it. And the terms on page 202 and 203. So we'll go over these terms right now. We're really getting to the end of your lab book. So the end of the semester is in sight. I'm sorry if I sound congested. I have really bad allergies this morning. So if we look at your digestive system, we have what we call accessory digestive organs and GI tract or digestive organs. Everything in the gastrointestinal tract is all connected as one long tube, and anything accessory would be outside the tube. So if we look at the GI tract itself, the digestive system starts in the oral cavity, and then food heads down the pharynx, which is your throat, down to the esophagus, down to your stomach, down to your small intestine, into your large intestine, and then out to your rectum and anal canal. So this GI tract is all connected as one long tube. Accessory digestive organs, which we'll go over as well, include all of your salivary glands, your teeth, your tongue, your liver, your gallbladder, and your pancreas. Within the oral cavity, we have what we call the hard and soft palate, and these make up the roof of your mouth. So if you reach up with your mouth and touch the top of your mouth with your tongue, you can feel the hard palate that's right behind your teeth, and the soft palate is even further back. The uvula is the little kind of teardrop structure in the back when you can open your mouth. When the doctor tells you to open up and say, ah, you can see that teardrop structure, the uvula, way in the back. So then if we look at the oral cavity, the oropharynx, your pharynx is divided into three pieces. The oropharynx is the part of the pharynx or throat right behind the oral cavity. We can't see any salivary glands here yet, but we will get to them. You can see your teeth here outlined and also the big muscular tongue. And you can see here a better picture of where the hard palate is located and the soft palate is right behind it. This is a great view of your epiglottis leading into your larynx, which is what we went over last week on respiratory system. And then you can see all of your teeth here, which we'll go over. And we'll also go over some of the tonsils. So this is a look at the salivary glands. Salivary glands produce saliva directly into your mouth to help digest food, especially the breakdown of carbohydrates. So we say that mechanical digestion begins in your mouth from chewing the food, but also chemical digestion occurs from the saliva that's being placed into your mouth from the salivary glands. Here's your parotid salivary gland. It lies right on top of your masseter muscle. And here's the parotid duct leading into an opening right by your molar teeth. And then your submandibular gland is right below your mandible, and your sublingual gland is right below the tongue. Each of these glands has a duct that leads into your mouth, and dentists know where these ducts of saliva empty into, and that's where they try to suck up all the extra saliva when you're getting tooth work done. They ask you for what a mesentery is and a greater omentum. When we talk about mesentery, you have several within the body. Mesenteries are folds of peritoneum or tissue that support and stabilize intraperitoneal GI tract organs. So these are just folds of tissue that support organs. Blood vessels, lymphatic vessels, and nerves are sandwiched between the two folds and supply the digestive organs. There's types of mesenteries. The one that you're responsible for knowing is called the greater omentum, and this extends downward or inferiorly like an apron from the greater curvature of your stomach and covers most of your abdominal organs. And this is a look at what the greater omentum looks like. And you can see how it's a tissue that covers over the intestines, which will be right underneath it. You'll also need to know the different layers or tunics of your GI tract. All parts of the GI tract, as you know, are connected with a tube, and they all have these 3 layers of tissue, or tunics, we call them. The mucosa is the innermost layer. The submucosa is the next layer down, and then the muscularis is the big muscular layer. The serosa or adventitia is the outermost layer. But you can see there the mucosa is made of epithelium, lamina propria, some muscularis mucosae. The submucosa has some glands, blood vessels, and nerve plexuses in it. The muscularis has an inner circular layer and an outer longitudinal layer. So the inner circular layer travels around it as in the diameter, and the longitudinal layer travels up and down with it. So here's just some definitions of the mucosa. It's the inner epithelial layer. The submucosa is composed of dense or irregular or loose areolar connective tissue. That's where we'll see lymphatic ducts, glands that secrete mucin, blood vessels, and nerves. Then the muscularis, you have an inner longitudinal layer, or an inner circular layer, which will constrict the lumen and form sphincters to close off the GI tract, and the outer longitudinal layer that'll shorten the tube and make it smaller. Then the serosa, also known as adventitia, it's areolar connective tissue. Serosa is the same thing, but it's just covered by a visceral peritoneum layer. This is the outermost layer of your GI tract. All right, so the esophagus is the tube that conducts ingested materials from the pharynx to the stomach, and the lower esophageal sphincter is a ring of smooth muscle at the bottom of the esophagus, which prevents materials from regurgitating from your stomach. So during vomiting, there's enough force to open up that lower esophageal sphincter to get the food contents from your stomach out all the way of your esophagus. So here's a small picture of your esophagus. There's also a sphincter at the top, which you don't need to know, but the big one, the inferior esophageal sphincter, is right at the opening between the esophagus and the stomach. And you can see here the histology look at the esophagus as well. You can see that the stomach lies right underneath the diaphragm. So the esophagus will come through the diaphragm at an opening called the esophageal hiatus, and the stomach will be right underneath that diaphragm. Here's the gross anatomy of the stomach. It's divided into different regions. The cardia region is the area of the stomach that opens up right underneath the esophagus. The fundus is the upper dome-shaped part of the stomach itself. The body makes up the majority of the middle part of the stomach. The pylorus region makes up the end of the stomach, right as it's connected to the duodenum, which is the first part of your small intestine. The pyloric sphincter opens up from the stomach into the duodenum, and you can see that there. Rugae are folds. They're not labeled here, but they're what are called these gastric folds, and rugae help to increase surface area to help with digestion. But rugae are what we call gastric folds that line the inside of the stomach. And then the greater curvature is the part of the stomach that has the larger curve, and the lesser curvature has the smaller curve to it. Then we'll move on to the small intestine. There's 3 parts to the small intestine. The duodenum, and I hope you can see my cursor, it's this C-shaped part right here that connects right to the stomach. So the duodenum connects right to the stomach, and then it curves back around into the jejunum, which is shown in purple. The jejunum makes up the upper 1/3 of the small intestine, and the ileum makes up the lower 2/3 of the small intestine. Then moving into the large intestine, we get another valve or sphincter. It's called the ileocecal valve, named for the ileum that connects the small intestine to the cecum, which is this pouch-like structure at the base of the large intestine. The ileocecal valve will open and allow waste material to pass from your small intestine to large intestine. The large intestine itself is also known as the colon, and it's named large, not because it's shorter than the small intestine, but because has a larger diameter, and we'll go through the large intestine in a second. The histology of the small intestine, I want to point out circular folds, also known as plicae circularis. These are the mucosal and submucosal tunics are thrown into folds, and those are what we call circular folds, or the plicae circularis. And again, these folds help to increase surface area to get food trapped in, to help with digestion, because most of digestion occurs in the small intestine. Also in the small intestine, specifically on the duodenum model, which we don't have, you'll see things projecting, a finger-like projections called villi and microvilli, which line them. You'll see submucosal glands, also called Brunner's gland. You'll see lymphatic nodules, intestinal arteries and veins, lacteals and capillaries, all in the small intestine as well. And I think I show you the picture of this histology right here. On page 202, we'll go over some of these. So these are what we have. A circular fold is this large plicae circularis, which makes up kind of this bumpy ridge within the small intestine. You can see the mucosa, submucosa, muscularis layers, and serosa listed there as well. Within the circular folds, we have what we call the intestinal villi, which are these little out pockets and little fingers sticking up off of those circular folds. And again, what this does is when you eat your food and it gets digested in the small intestine, all those food particles get stuck within these villi. And if we look at one villi here, an intestinal villus shown blown up, you can see that it's lined with different cells, and each cell does something or secretes a substance that helps with digestion, whether it's a goblet cell producing mucin, a gland, something secreting hormones. So these cells are all important for helping digest your food. You can see in the mucosa layer, you have goblet cells. You also have a capillary network of intestinal arteries and veins kind of reaching up into the villus. You have a lymphatic nodule. The lymphatic nodule helps to defend the body against anything harmful it might have eaten. And then you have a lacteal, which is this structure that goes between the artery and vein. And you also have more lymph vessels and venules and arterioles in the submucosa layer. Okay, then moving on to the large intestine. If we look at the large intestine, the first part of the large intestine where the ileum, again, that third piece of your small intestine attaches at the ileocecal valve, and this is called the cecum. It's a blind-ended pouch at the base of the large intestine. Coming off of this cecum is your appendix, and your appendix is this little finger-like structure. It has no known purpose in the body, but it can get inflamed with a bunch of junk. And if it were to burst, that would be extremely harmful to the surrounding tissue. I'm sure you guys know of someone who's had their appendix burst or close to it. So then moving up, we call this part of the intestine, the large intestine, the ascending colon. So again, we refer to the large intestine as your colon. So if someone has colon cancer, it's cancer of the large intestine. And then at this part where the intestine curves, we call this the right colic flexure, also known as the hepatic flexure because it's next to the liver. Here's your transverse colon, the left colic flexure, also known as splenic flexure, is located by your spleen. And then your descending colon. Your sigmoid colon is the part of the large intestine that starts to curve like an S-shaped. And then the rectum and anal canal, the rectum is the final piece of the large intestine, and the anal canal is where all of your feces would be eliminated. Coming up and looking at other terms you need to know, haustra are pouches of the large intestine. So one haustrum is one kind of pouch, and food will get kind of mixed and propulsed and pushed forward within the haustra. The Taenia coli is this long kind of line you see running through the middle of all of the haustra. And that Taenia coli is just a muscle that helps to move food along within the haustra. Not food, it's completely digested at this point, so we call it feces. Then moving on to the liver. The liver is a very important part of your digestive system because it sifts through and goes through and takes out all the bad things that you could have eaten. So all the toxins from drugs, alcohol, anything else your liver filters through and detoxifies your blood. So you'll have the big inferior vena cava attached to the liver, bringing blood back to the heart from the liver that's been filtered. And you'll also have a hepatic portal vein and hepatic artery that's bringing blood to and from the liver to be filtered. So within the liver itself, you have a right lobe, and again, it'll be on the right side of your patient's body in anatomical position. A left lobe, you'll have a caudate lobe on the posterior side and a quadrate lobe on the anterior side. And then you'll have this falciform ligament that helps to connect the liver to the surrounding peritoneum or tissue around it. Underneath the liver, you'll have a green gallbladder, and it actually is green colored because the gallbladder stores bile, which helps to digest fats. So your gallbladder will look green, and then your pancreas will get to as well. This is what we call the biliary apparatus, and this includes how bile is transported from the gallbladder into your duodenum as well as the pancreas. You should be able to know the ducts leading into and out of the gallbladder and the ducts leading into and out of the liver and the duct within the pancreas. So I'm going to go back to this picture. So we'll zoom out first of all. The liver is what creates bile, which helps to digest fats, and the gallbladder just stores bile. So you can live without your gallbladder. Many people get it removed if they get gallstones in it. The liver will continue to produce bile, it just won't have a place to store it. So if we look, so now we're going to zoom in on this gallbladder. The tube or duct leading into the gallbladder is what we call the cystic duct. And I'm going to show that right here. Here's stored bile within the gallbladder. Here's your cystic duct, which eventually joins up with the common bile duct, and the common bile duct is what will join into and empty its bile into the duodenum, that first part of the small intestine, to help digest fats. The common hepatic duct is the duct that takes the bile that's being created from the liver and takes it to the gallbladder itself. So you have a common hepatic duct. It branches into right and left hepatic ducts as it goes into the liver, but it will join up with a cystic duct from the bile to create what we call the common bile duct, which brings bile into the liver. And the pancreas also has its own duct, and we call that the pancreatic duct. And the pancreatic duct just brings any sort of digestive enzymes from the pancreas into the duodenum as well. So you should be familiar with how this model looks together, one that's really similar to this, and what the ducts are called in each of these. So just pay attention to this model because you will have questions about this one. So here's a look, kind of a zoomed out version of that pancreas. The pancreas is what produces your insulin. So that's the endocrine function of the pancreas, the hormone it secretes. The exocrine function are things that will go through the ducts into the duodenum. And those are all digestive enzymes that travel through the main pancreatic duct into the duodenum. And here you can see your common bile duct coming from the liver and the gallbladder as well. A couple more things. I think I'm just going to go back to our liver model to make sure we got everything listed for the liver model. The hepatic portal vein and hepatic portal artery will bring blood to and from the liver, and then the inferior vena cava you can see there as well. I think we got most of those. Okay, with that, I think the last part of this lab is just looking at your teeth, which are important to help mechanically digest the food. We'll go over the teeth structure a little bit for you. They're collectively known as dentition. The crown is the part that's exposed that you brush. There's a neck and then roots. The alveoli are the sockets. The crown is formed by tough enamel, which is the hardest substance in the body, and dentin forms the primary mass of a tooth. So your teeth, the center of the tooth is the pulp cavity that contains connective tissue called pulp, and the root canal is continuous with the pulp cavity, and these are where your blood vessels and nerves pass through. So if someone needs a root canal, they need work done on their root canal, and it can be really painful if you're not completely anesthetized because there are nerves that travel within this pulp cavity and within the root canal. So your enamel covers your crown, and the enamel is the hardest substance in the body. Your gingiva are just your gums. You can see your dentin here makes up the mass portion of the tooth itself. The pulp, the root canal, the apical foramen has to do with this opening at the bottom of the root where blood vessels and nerves will travel to. And that takes you through the majority of the anatomy of the tooth. Then you'll need to know which teeth are your canines, incisors, premolars, and molars. There's two sets of teeth that developed and erupt during your lifetime, your deciduous teeth, which are your baby or milk teeth, and then your permanent teeth. So you have 20 baby teeth and 32 permanent teeth. The incisor, those are the most anterior. The canines are right next to your incisors. They look like the sharp kind of triangular type ones. Then you have premolars and molars as we work our way back. Each quadrant has 2 incisors, 1 canine, 2 premolars, and 3 molars. So we look through the quadrants, and if you go to the dentist, you get charged per quadrant. And your wisdom tooth is your 3rd molar that can come in. Many of you probably have your wisdom teeth removed. I do not, but they really hurt when they were coming in because they usually come in around your 20s. So here are your incisors. You have 2 of them per quadrant because you have a central incisor, a lateral incisor. Then your canines are what I think of as the dog teeth. They look pointy. Then you have 2 premolars, 2 molars, and then the 3rd molar is your wisdom tooth. So that takes us through this lab. Remember to do your lab pages. There will be a quiz on this in a week. I hope you guys are all doing healthy and well. Take care.